my name is Kevin, and I have been taking care of my wife, who has had Parkinson's for about 15 years now.
My name is Dorothy, and I cared for my husband Jack, who had kidney cancer. I cared for him for a little over 2 years.
What is your greatest challenge as a caregiver? Honestly, it's juggling my work with the unexpected curveballs that my wife's disease can throw at us sometimes. She also suffers from dystonia, which, just out of the blue, her legs will cramp up and it immobilizes her. She can't move, she can't get around. And it could happen just about any time, in the middle of the night, while we're out for dinner. It happened in the middle of our son's wedding. But she sometimes says that we have Parkinson's because of just how much her situation impacts me and my life. But when I'm with her, I know what she needs and the quickest way to alleviate the pain, because we've been in this fight together for years.
The feeling that you're putting your life on hold. When you become a family caregiver, I don't think anyone realizes how disruptive it can be to life as you know it. It's all about accepting the circumstance and establishing a new normal, particularly with chronic diseases and terminal illnesses. I used to see this all the time when I was a nurse. It's really stood out to me how different family and friends struggled with this same thing.
Hello there. I'm John Shaw, CEO of Caregiver Action Network. Today, there are more than 90 million Americans caring for a loved one in this country. Those family caregivers express the full spectrum of caregiving. Some are caring for an older loved one. Some are caring for a child with significant health care needs, such as autism. Some are caring for a family member, a friend, a spouse, or a neighbor with a disability or chronic condition like Parkinson's or MS. We started off this module with family caregivers sharing a bit of their story and talking about how they want to best care for and support their loved ones. We'll now be going more in-depth on what those wants are and how family caregivers can support you, the professional care team. I want to give some clarification on a couple of the terms I just now used, because you'll continue to hear them throughout this module and the other 3 modules included in this series. When we use the term long-term care community, we're talking about a variety of settings, including nursing homes, skilled nursing facilities, and assisted living facilities. The term care professional is used to identify any and all staff at those facilities, including but not limited to medical staff, nurses, administrators, social workers, case managers, and patient and family advisory committees. For me, as CAN's CEO, the mission of Caregiver Action Network is deeply personal. I'm a long-distance caregiver for my mom, who lives halfway across the country from me. So I fully understand the stresses of ensuring that your loved one is well taken care of, even when you can't be there physically. This requires a fair amount of coordination in order for me to ensure that mom is being taken care of and has what she needs. We all face caregiving coordination challenges, and this module is designed to explore the support that a family caregiver can provide the professional care team in order to ensure their loved ones receives the best care possible. Now, at this point, I will be handing the presentation over to Jessica, and she will be guiding us through the rest of this module. But before I turn it over, I'd like to recognize our sponsor, Omnicare Pharmacy, a CVS Health company. Their support allows us to bring this information to you.
Thanks, John. Before I get started, I want to mention that this module is one in a series that can all be accessed at caregiveraction.org/omnicarepharmacy. The topics of the other coordinated modules include why family caregivers matter, the needs of family caregivers, and the critical role of family caregivers in the transition of care. We kicked this off by describing the vastness of caregiving by mentioning just a few of the many caregiving scenarios that exist across those 90 million caregivers. The child caring for their aging parent, the parent caring for their child with a disability, the partner caring for a veteran returning home from combat. But regardless of the specific caregiving scenarios, there are things that all family caregivers want. Let's start with the most obvious. They want the best for their loved one. They want their loved one to be receiving the best care possible so that they are healthy and comfortable. This holds true not only across all caregiving scenarios we've touched on, but across all care settings as well, everywhere from the doctor's office to their loved one's home. But let's look at this specifically through the lens of someone moving to a long-term care community. All of the decisions leading to the move, and even to the specific facility itself, have been chosen with their loved one's care being of most importance. The choice to move to a long-term care community usually begins with the realization that they will receive the best care there as opposed to any other setting. Equally obvious to this being the primary want of family caregivers is that it is a want or goal of all members of the care team, family caregivers, as well as healthcare and service providers. We're going to talk about a couple of more things that family caregivers want, but we start here because those wants are a product of wanting the best care for their loved one. This trickles down into all of the conversations you may be having with either the resident as well as the family caregiver. It's important to keep this in mind if you ever start to find a family caregiver being overly inquisitive or critical. Let this perspective frame the way you receive those questions or comments. This allows you to address any questions or concerns by acknowledging that we both want what is best for your loved one. So what specifically do caregivers want in order to ensure their loved one is getting the best care? Family caregivers have a more in-depth and intimate knowledge of their loved one than anyone else on the care team. Family caregivers see the resident in their own homes and for a longer period of time than anyone in the provider community. They are experts on their loved one and want to share that information so that you get a full picture of who their loved one is. They are your source of medical history, but also more intimate details, like what their loved one's preferences are. Having knowledge about some of these preferences can make a world of difference in how you approach the one-on-one care that you provide, ultimately making your job a little easier while ensuring the resident receives best possible care. Let me provide an example of what this might look like. Let's say I care for my mother with Alzheimer's, and I'm helping her transition to a long-term care community. In addition to going over medical history and sharing what medications she is currently on, I might share that there is a specific photo album that my mom likes to look at if she is feeling agitated or upset. I can help make sure that photo album is somewhere easily accessible. Going through this process has equipped the staff with the information they need to best handle a situation where my mom is upset, and I've ensured my mom is getting the best care possible. This ultimately makes the job of the care team a little less hectic. Family caregivers want to help when they are visiting their loved one as well. This can play out a lot of different ways, so I use another example to further explain. Let's say I'm visiting my mom, and she mentions that she has been feeling a bit colder at night. I ask mom if she would like an extra blanket for her bed, and she says yes. One of the care professionals had let me know where extra linens were stored when I was helping mom move in, so I'm easily able to find an extra blanket and get it on the bed. This is one less call button rang and a few more moments that the professional care team has to complete other tasks. And what's better? I can leave knowing my mom will be a bit more content in bed that night, and I haven't had to pull staff away from helping other residents. I was able to easily and quickly do this on my own. These types of examples are easy to overlook in the transition process, but can make a world of difference long term. Other examples might include getting a cup of ice or a snack, or helping their loved one navigate the television. All members of a resident's care team are working with one main goal in mind: providing the best care possible, resulting in better health outcomes and maintaining the highest quality of life. As we continue to say, family caregivers are a wealth of knowledge. Yes, they know their loved one's health history. Yes, they know what medications their loved one is on, But their expertise goes deeper and helps you see the resident in a more holistic way. In addition to telling you what medication they take, they can tell you what time of day their loved one prefers to take it and what snack they might like to take with it. They can share what they've done to get their loved one to take their medication if they are being resistant. At the end of the day, these tips save you, the professional, time and headaches. Family caregivers also want to ease your workload, so let them get their loved one an extra blanket for their bed or that cup of ice. Another benefit to utilizing the family caregiver's desire to help, it builds upon and strengthens your relationship with the resident. This goodwill goes much further than one might initially think and helps to ease the coordination of care in the long term.
What is your greatest reward as a caregiver? Just being a caregiver is a reward, I find that rewarding. And I guess it's rewarding to know that our wedding vows actually mean something, in sickness and in health, and that I'm able to stick to those vows. And I know she would do the same for me if the roles were reversed.
Being by my husband's side throughout his many hospitalizations, and when he was finally transferred to hospice care, I rarely left his side, only to shower, get a bite to eat, sometimes take a walk. In the end, I didn't want to miss anything because I didn't ever know how much time I had left with him.
What is your one piece of advice for a family caregiver? I was in the Boy Scouts, so be prepared is probably the best bit of advice I could give. And with conditions like my wife has, you never know when you're going to be forced to jump into action. I always try to have a contingency plan or escape strategy anytime we are traveling or at dinner or not at home, because you never know when you're going to need to jump into action.
Build meaningful relationships with the team that is caring for your family and loved ones. It will get you further with them and ultimately ensure that your family or loved one receives the best quality care. It may sound simple, but we are all human doing the best we can. Be kind. And don't forget to be kind to yourself. It's impossible for you to do everything.
Thank you for tuning in to learn a little bit more about what family caregivers want and how they can support you and your fellow healthcare professionals. I hope that the information in the stories shared by family caregivers has given you a deeper understanding of what family caregivers do and the impact it has on their loved ones' care. Be sure to connect with Caregiver Action Network on social media and visit caregiveraction.org to find more information and resources for family caregivers, including our Caregiver Help Desk, a tool that connects family caregivers with caregiving experts via phone, chat, or email to find answers to difficult questions and be heard.